Namaskar. I am Dr. Manish Pathak. I am working as a senior consultant organ transplant anesthesia and critical care in Sahyadri Hospital about organ donation and brain death concept. Reason behind this is 5 lakh patients in India die every year of liver disease. 50,000 patients die of cardiac disease. 1.5 lakh patients are still waiting for kidney. So why is all happening? That's all because of non-availability of organs to the required patients. What do you mean by organ donation? What do you mean by brain death? The concept of brain death was introduced in the world in the year 1968. That came in India in the year 1994. You can imagine the time gap. At 2016, we are still struggling to explain the concept of organ donation and brain death to the common people. Can Sahyadri Hospital do something in that regard? For that, we are here. What do you mean by brain death? The patient whose brain has stopped functioning, who's admitted in your ICU, is called as brain death. What exactly it means? Can all the doctors do it? Yes. The doctors who are working in the ICU for more than 5 years and who have good experience in diagnosing brain death can certify brain death. What exactly this means? Performing few specific tests at bedside without moving the patient from one place to other place, checking the reflexes of the patient, and at the end of that examination to know whether these reflexes are present or not indicates whether the patient is brain death or not. Which patient lands up in brain death? Patient with severe head injury, patient with severe intracerebral hemorrhage, patient with brain tumors who during the course of treatment end up in deterioration in their neurological condition can become brain death. These brain death patients are the potential candidate for organ donation. So what do you mean by organ donation? The patient's relatives are counseled so that they give consent for organ donation. Which organs can be taken? 9 lives can be saved from one patient who give consent for organ donation. Hence, Sahyadri Hospital has started the organ donation drive through different channels. What is brain death? It is irreversible damage caused to brain because of some reasons. Once you have done all the required testing to diagnose the patient brain dead, who can certify brain death? Neurosurgeons, neurophysicians, physicians working in ICU, anesthetist, intensivist. These are the people who can certify brain death. It is a medical legal certificate, need to be handled very carefully before handing it over to the patient's relative. What happens next? Relatives counseling is very much important. How to counsel the relative? It depends upon how experienced your medical social worker is. All the patient's relative will not accept at the first instance that your patient is brain dead and you want to donate the organ. There is something called as a grief counseling. You have to give patient's relative enough time to accept the brain death and then counsel about the organ donation. When you explain the patient's relative as brain death, that time you have to tell them the patient's body will be warm, his heart will be beating, his blood pressure will be maintained with medicines, and his ventilation is maintained with artificial ventilator. These are general misconceptions among few doctors as well as patient's relative about brain death. Once we explain the patient's relative about the concept of brain death, that the patient's body will be warm, patient's heart will be beating, his blood pressure will be maintained with medicine, then the next session of counseling comes. During the process of brain death certification, the staff may notice some toe movements, some hand movements, which might be spinal reflex and need to be ruled out and examined by senior neurophysician or neurosurgeon on duty. During the session of counseling with the patient's relative, you have to be very specific in explaining the patient's relative what exactly this process is. Each organ donor can donate 9 organs to save 9 lives. Whether my patient's body will be disfigured? No, nothing of such things will happen and your patient's body will be not at all disfigured. Once the patient has donated the organs, can we perform the normal rituals? Yes, you can perform all the normal rituals as per religious belief. Does our responsibility finishes here? No. We make it a point that all the medical legal formalities are completed in time without causing any stress on the patient's relative. Two important questions generally many relatives come and ask, that my patient is in coma and can he donate organs? It's strict no. We need to conduct some specific test on a patient to decide whether a patient is brain dead or not. If the patient is not brain dead, he can't donate the organs. Important aspect of organ donation. Since this organ donation is completely voluntarily activity, we at our hospital doesn't promote any monetary or financial benefit to the relative's family. We get many calls from the patient's relative that our patient is dead and they want to donate the organ. For their knowledge, only cornea can be donated once the patient is dead. Rest of the organs has to be donated when the patient is brain dead but his rest of the organs are functioning with some support. Our vision to ensure that no Indian dies for want of an organ. To achieve this vision, our mission is to ensure that every Indian that is suffering from an end stage of organ failure be provided with the gift of a new lease of life through life-saving organ transplant.